Sunday, and today I'm going to be talking with you guys about canine and feline vaccinations. Golden Gate Animal Clinic says, vaccines help pets live longer and healthier lives. Are dogs and cats a part of your guys' life? If they are, then you know that vaccines are the main thing to keep fatal diseases away from them and protecting them. The ASPCA says vaccines help prepare the body's immune system to fight invasions of disease-causing organisms. Today I will inform you on canine and feline vaccinations. I will let you know what vaccinations your feline or canine may need, when they are due, and what to look for afterwards. Before you get your pet vaccinated, you need to know what they need. The main three vaccines for canine is the distemper parvo, which protects them from distemper, hepatitis, parainfluenza, parvo, and coronavirus. The second vaccine is the Bordetella, which prevents kennel cough. That is it's a very easy sickness they can get from dog parks, kennels, groomers. It's a disease where you just kind of have to let it run its course with antibiotics. And the third is the rabies vaccine. For the felines, in the Royal Canin Kitten Care Guide, it states, the core feline vaccines include FERCP, feline leukemia, and rabies. The FERCP vaccine protects your cat from any upper respiratory diseases, which is very common in cats. The feline leukemia, in a book called Cats by DVM Robert Kirk says, it's the most important fatal infectious disease for the domestic cat today. Feline leukemia is caused by a virus that spreads in all sections of an affected cat, especially in the saliva. The third vaccine would be the rabies, just like the canine. Before you get your pet vaccinated, you need to know what you need and the age. For canines, the vaccines start in a series of 3, and they're all 3 to 4 weeks apart. You start your first set of vaccines at 8 weeks. Dr. Tim Connor, DVM, says the reason we don't like to vaccinate less than 8 weeks is because the mother's enzymes are still in the pup or kitten and will fight off the vaccines. So when you get your first set of vaccines, they will be 8 weeks, and it's be the first distemper parvo. Then you go in for your second vaccine, which is the second DHPPC and your first Bordetella. This is at 12 weeks. Ashley Sy, senior vet tech, says, giving a Bordetella can be difficult with some dogs, but luckily, as long as it touches the gums, they are set. And for their third set would be their third DHPPC, which is the distemper parvo, and their first rabies. This is at 16 weeks. After that, you wait a year. For felines, just like canines, it's all in a series of 3. 3 to 4 weeks apart, you start at 8 weeks. The first vaccine for a cat would be their first FERCP at 8 weeks. The second set would be their second FERCP and their first feline leukemia. But before your cat is vaccinated for feline leukemia, you have to have them tested for leukemia. And their third set would be their third FERCP, their second feline leukemia, and their first set of rabies. Now you know what vaccines are needed and when they need to be given. But now it's time to talk about what to look for afterwards. After vaccines, a tech or a doctor should tell you to look out for response or reactions. A reaction is a negative thing for an animal. It is a negative reaction. The symptoms are swelling in the face or legs and paws, vomiting or diarrhea, and their body itching. A response is a common thing. This is usually 24 hours after your dog or cat has been vaccinated. It should last only 24 hours. The symptoms are mild fever, loss of appetite, soreness in the vaccination area, or sometimes no responses at all. Now that I have informed you on feline and canine vaccines, I hope you have a better understanding for your feline and canine friend. First, I explained the type of vaccines, which for the dogs were distemper parvo, Bordetella, and rabies, and for the felines, the FERCP, the feline leukemia, and rabies as well. I have told you when to start your vaccines, which would be at 8 weeks, and what to look for after. Now that you know this, you can do whatever you need to keep your furry friend healthy and live a longer life.